Hello, everyone. This is your host, Susan Rosen, and my guest today is Dr. Lonnie Herman. And we just have had so much fun chatting that it took us a while to actually turn the record button on. So I hope you all enjoy this one as much as I enjoyed our pre-chat. And I'm going to ask Lonnie, is it okay if I just call you Lonnie?
If you want to now.
Okay, thank you. Ask Lonnie to introduce himself and tell us a little bit about himself, and then we'll go from there.
Thank you for having me on. I appreciate the opportunity to share my work and what we're doing with people who come to my clinic in Southeast Florida, where I'm located now. People who come to us from Florida, from across the United States, and people who come to us from other countries as well for this unique service that I offer. That's very effective and very safe. I call it the Rapid Health Restoration System. And literally from different chronic ailments, whether it's asthma, to whether it's allergy reactions like hives, reactions to foods or different fragrances, to brain fog, to celiac disease, to bladder incontinence, to irritable bowels, to migraine headaches, to autoimmune diseases like lupus and arthritic pains and fibromyalgia, and even with MS. And I've got a long list of where we have a lot of tremendous amount of success in helping people restore normal function to their body. And I can give specific details, or I'll tell you that I've got video testimonials with people, before and after videos of them, discussions with them, before and after pictures with them, of rashes that are gone they had from a lifetime. A woman with MS where she couldn't move her legs for 5 years, complete paralysis. She's able to move them now. A woman with urinary incontinence for 10 years, no more with this work. Migraines for 40 years, one woman, 40 years, terrible, debilitating migraines, gone after working with me. And there's many other incredibly positive outcomes. Even a man who had a slow learning problem, he was not able to graduate high school. He failed one of his grades. He failed multiple times that he dropped out. Never thought he could make it in life. Now he's got a job for the government. He takes care of his family, which was impossible for him before. We got his brain to clear up. So the bottom line is, it's all about finding the causes of the ailment in the person, or ailments, or symptoms that the person's suffering from, and helping to clean the cells from these disease-causing infections and toxins. I'll tell you, I started out as a chiropractor, and the only reason why I chose that in life is because my mother, when I was 15, I had no great instruction growing up of like to do or be. There was no leading me along the way besides work for yourself, is what I was told as a kid. Don't just have a job. You should have your own business. At least that instruction was given to me. But when I was 15, my mother sat me down one night and she said, "You got to pick something to do in life. Doctor, dentist, lawyer, pick one." And I said, I don't know. I mean, how do I figure that out? So anyway, we had a friend who we grew up with in summer camp. Her father was a chiropractor. We called him Dr. Cohen, and he was a nice person, and he seemed to have good financial success, and he was on vacations, and it was a very calm, easygoing environment in his office, and there was no cutting. I'm not too good around like blood, so on. So anyway, my older brother, I'm one of three. My older brother and I chose chiropractic. We were into physical fitness and working out and so on. So that was the direction that we took. But I realized quickly when I came out of school that it wasn't the answer that I was taught it was in the school I went to. I didn't even know why I went, but still, I like chiropractic, but it wasn't getting rid of every headache. It wasn't getting rid of heart disease. It wasn't getting rid of fibromyalgia. It wasn't getting rid of thyroid disease, diabetes, and the list goes on. I wasn't able to help somebody with lupus or MS and so anyway, I went back to school for neurology. I went back to school for neurochemistry. I went back to school for neuroimmunology, endocrinology, for developmental disorders of the human brain. I went to school for movement disorders, alternative cancer treatments, the connection of dental disease of the mouth and the whole body. And there's more without mentioning everything. I realized something when I took the immunology program. The immunologist had taught us and showed us from documents, from research papers from laboratories around the world, where the the scientists who ran these experiments were not, or investigations of disease, looking for causes of disease. These doctors were not funded by drug companies to say the drug was the answer for the reduction of the symptom of the disease. These doctors are looking for the causes, and every single of dozens of papers that this immunologist gave us, every single report showed that it was hidden, deeply embedded infections that got into tissues of the human body that made the arthritis happen, that made the heart disease occur, that made the lupus or made the thyroid disease or so on. And it was also toxins. So that opened my mind and my eyes a lot to of really realizing why chiropractic wasn't helping everybody get better, but also why people who had gone to conventional medicine and possibly other alternative methods of care, why those different treatments and methods didn't work for them either, because the different strategies that people have been through weren't finding the cause. They weren't finding why the body was so upset. Some cases they could, but in too many of these chronic illnesses, they just weren't successful. So I spent a long time at trying to figure out, figuring out the how and the why. And there's work that I do now that's developed from biophysicists and through quantum physics studies that we're able to apply these different strategies, and the results are just nothing short of remarkable. So that's my story.
Wow. Okay. I don't even know where to start asking you a question.
I'll tell you, I just got off the phone. If I could share something. We just had a patient. There's a woman who's been a patient of mine for on and off for a couple of years. When I say a couple of years, not like it's taken that long. She had multiple different symptoms. She found me years ago because her mother had problems. And so she brought her mother to me, success with the mother. She became a patient. She referred to many people. So I'm going to say a couple of years, not like she's coming to me every month or every 6 months or so. No. She came, but she brought her husband here recently, just about 2 weeks ago. She brought him to me. He's like 6'4", this man. He lost over 60 pounds, more than, I think it was close to 70 pounds he lost. He's been sick for, at the time I saw him, he was in the hospital for a month. They couldn't figure out why. He was short of breath. He was losing weight. He couldn't put weight on. He couldn't eat food. He could barely eat food. So short of breath, he could barely speak. Went from being 265 pounds of 6'4", down to like, I think he was down to, maybe it was like 90 pounds. He lost a lot of weight. He was just this bony, I'm not emaciated looking person who could barely speak to me in a wheelchair. The hospital couldn't offer him any more. The nurse said he doesn't have much longer. They don't think it was ALS, but they don't know what it is. So I examined him, and we found that it was one of the new viruses that we've become familiar with in the recent couple of years. I won't say the word. And also that there were certain chemicals that were, let's just say, under stress from the job. There were certain things that were injected into him. I won't get into the specific words that were used, right? You kind of get an idea of what I'm talking about, of an injection that was given in the past couple of years. All of a sudden, his body starts to fail to where he can barely breathe. He can't keep food down. He's losing weight rapidly. And all the hospital, all the evaluation, they can't find anything in the respiratory test. Besides that, it wasn't good function. They couldn't find anything in an MRI. They couldn't find anything with a CAT scan, with X-ray, with blood tests. They can't find anything. They can't make a connection why his body is failing. And so I just got off the phone with him and his wife before I got on this discussion with you, this interview with you. And he's on his, I think it was 11th day of his customized protocol that we designed for him. The wife tells me, I get a message. The reason why I called him before is because now I get this urgent message. I should call him because he's coughing so much and they're very stressed. Right? I look at the message and I'm thinking to myself, he's coughing. He couldn't even cough before. He could barely even speak before. And he's just like gasping for air and his chest is compressed. He's feeling like he's just choking, right? So, but he's able to cough now. Coughing is good because it's one of the natural mechanisms to get things out. So he was able to talk to me on the phone.
Whoa.
And he's coughing. He wasn't coughing continuously. It's not like he just had
Yeah.
He just picked up the flu. It was like his body is phlegming and getting things out now when he couldn't before.
Uh-huh. Yeah.
So his wife tells me he's able to bend over and still breathe. He couldn't do that. He couldn't even hold his head down over the sink to wash his face or brush his teeth. He would just lose his breathing like that. So he had to stay sitting back or in a recliner. Now he's able to do that. He's coughing up, which was impossible before. He's able to put some food down, which was very difficult before. And he's breathing better. And even before, when he tried to take a deep breath, his shoulders would have to like creep up by his ears to try to get some air in. That's not happening anywhere near as much. The wife told me he's doing a lot better because they're seeing the reduction in the symptoms. Before I started assessing him, before I did this exam with him a couple of weeks ago, or I should say right at that time, I get a call from this man's mother, the mother-in-law, the mother, I should say the patient who's been here, her mother-in-law, so his mother. The nurse who comes to the house to evaluate him or to assist him tells his mother that she doesn't think he's going to last much longer, just to start to get affairs in order, because he's, it's going to take him. It's just, sorry to say, but this is usually what happens. Basically, was the news that the nurse gave the mother. The mother calls, "You're crying." I said, "Just sit tight. Let's see what we can, what I have found in him, what we can do." Which I found his diaphragm was infected with that virus. I found the trachea was infected with the virus. I found the lungs. I found the bronchi. I found other parts of the body, stomach infected with the virus. So he's now following the protocol. He's able to talk. He's able to breathe better, able to bend over and not lose the breathing function. He's able to swallow some foods better right now. This is only in the second week, like for day like 11, I think it is, of his protocol. He's got another about 29 days to complete all the steps that I outlined, but we're already seeing the wife was just crying and laughing and saying thank you on the phone because they're seeing the improvement. So I'll tell you, there's nothing that brings greater joy than being able to help somebody defeat the disease, and to be able to prove others who have sort of diagnosed them as, you're never going to make it out of this battle, to not prove that community wrong. So it's fun.
Yeah. Oh yeah. That's why you keep going into work.
Yeah. It's not even work. So yes, but it's fun.
Yeah.
It's work, but it's fun.
Yeah. No, I understand. Yeah. Yeah, absolutely. So how do patients find you?
A lot of people through referral, because once one person where it's, like him, like there's no way that it's ever, how could you ever do that? And then when people see and there's like, who's the person who did this for you? So we get a lot of referrals, but also people find me on my website, which is drlonnieherman.com, DRLONNIEHERMAN. They could pause it, rewind, and listen to that again, drlonnieherman.com. And on my
I'll put
YouTube
it in the
channel,
show notes.
thank you for that. YouTube and Facebook and Instagram, I've got a lot of information up there. I've got a free ebook, a free copy that they can download on my website. It's like 40 pages and a lot of big pictures and big font. So it's all written very easy to understand layman terminology, and it's all, it takes maybe 30 to, I don't know, depending on the person, 40, 50 minutes to read it from beginning to end. And I've got certain links in the book that there are certain videos where I'm describing things, how I do what I do. And but anyway, people, they find me through referrals or they find me online. And again, like I said, we have people who travel to us from across Florida, across the United States for this work, as well as from other countries, even as far as UK, Ireland. We've had from Romania, Dubai, Africa, Australia, Israel, New Zealand, Netherlands, Switzerland, Sweden, coming here, Canada, Mexico. It's quite enjoyable.
Excuse me, it doesn't surprise me. I mean, especially if you're getting it from referrals, people are interested in getting healthy. They don't care where the doctor is.
Yeah, I agree. And it's also, and some people are fighting for their life. And it's, people have to do it. And we'd love to be able to be the team who can help somebody achieve it. But even if they're not just like fighting for their life, like this man, breathing barely, now better. But we had a mother brought her daughter who's 19 years old from Ireland to our clinic
Uh-huh.
right before they did the lockdown here, where people from other countries couldn't get into
Oh,
certain
yeah.
other countries. And so she, 19, her whole life, rash on the body, rash,
Mhm.
bad neck, chest, arms, back, rash. She had brain fog. She had asthma, environmental
Mhm.
induced asthma. She had
Ooh.
constipation. 19 years old, her whole life. The mother, her first child, the first child, who's now 19, ever since she was born, all these symptoms going on. Poor mother. I mean, it's a brave woman, and just
Yeah.
sick child who nobody was able to help. So they come here in one protocol, which we designed the protocol that she took home, or we shipped them home in Ireland. And I get a call that was like 2 months into that protocol. All the rash was gone, all the asthma
Wow.
was gone, all the brain fog gone, constipation gone. And so they did a video testimonial with me we did a Zoom
Uh-huh. Yeah.
discussion that I have up on my YouTube channel. All the symptoms gone in one protocol, in one treatment that was easy to follow at home.
Wow.
And the whole
Yeah.
life she suffered. So what a big difference. But it's not always that fast. But it
Yeah.
is, if it takes 2 treatments or 3, it's better than a lifetime of misery or
Oh,
or
yeah.
earlier.
Absolutely.
Yeah. Yeah.
Yeah, for sure. For
So
sure.
people, they find me through online, and people travel in. We've got a page on the website, a FAQ, frequently asked questions page,
Uh-huh. Uh-huh.
where so there's advice if they're coming in from another country, how to set it up, or how they're coming from another
Mm.
state, how to set it up, where
Mm.
what's a local airport, what's different hotels, how long do I have to stay, what's the investment, and all that. It's all outlined there. So everything about what I'm doing and everything about everything in the clinic is very transparent on my website.
That's fantastic. Wow. Wow. So how many people do you treat at a time? I mean, is
I can
there like,
only do one a
yeah.
day for how involved, and that's a good question, because the type of exam process I do, the type of investigation, the strategies, the steps I use to be able to figure out the condition with the person,
Uh-huh.
it one exam with one person can take all day.
Mm-hmm.
Literally,
Makes
there are
sense.
some people on a first visit. We could be in here from the whole day. It could be like 6-7 hours with a person. Might have to take a bathroom break, basically, but basically it's
Yeah.
through the day, and then they
Uh-huh.
go home.
Yeah.
So there are days where I can only see one person
Uh-huh.
for an initial visit. For a follow-up visit, we may be able to see 2 people in a day. And that's it. It's
Uh-huh.
very one-on-one. It's very focused. And for me, I am looking to, I want people better as soon as possible. The sooner that we could see the improvement, the happier
Yeah.
I am, the better for me, the
Uh-huh.
better for them, the better for the world, because we can show more of what seemed to be impossible to now make
Right.
possible in a short period of time. So, but so I put everything that I can figure out to do in the exam to help a person get better faster. That's what we're all about. The
Mm-hmm.
sooner somebody's better, the better it is for everybody. I don't need it to take, if it only takes one treatment, why take 2? I don't need it to take that one. I'd rather
Right.
have more improvement testimonials online, more of my trophies online, and do it a lot more people. So
Yeah. Yeah.
yeah,
There you
so
go.
that's about it. It's so we're working about 4 or 5 days a week, because it is pretty exhausting work.
Oh, I
And
bet.
I mean, there might be a week where it's just overwhelming, and we have to put a 6th day in for somebody who's just desperate to get
Mm.
in, or they can't wait another couple of weeks to come in. But that's it. It's 1 to 2 people in a day that we can see, and they're following their treatment at home. And excuse me, and then I have a follow-up visit with the person. Let's say the protocol lasts them maybe 3 months, 4 months, 2, 3, 4
Mm.
months, or somewhere in between those month periods, 60,
Yeah.
90 or so days. It's we see them again, and sometimes it takes more than a second treatment, but it's on average, we're able to measure that the person is improving throughout the protocol. Again, they're doing it at home. We have periodic discussions through when they're at home and they're following their protocol. Periodic
Mm-hmm.
phone calls if they need to talk to me. If it's not that we reach them first, they reach me first, and we can have a discussion.
Mm-hmm.
Again, but there are some cases, some puzzles that are a bit more difficult to solve. So
Yeah.
I keep advancing. I keep on thinking, how can I make it better? But there are some cases, like Lou Gehrig's disease is not the easiest one. I'll put it that
Oh, I
way.
bet.
Yeah.
Yeah, that's, eh. Yeah. Well, it's add from personal experience. Not that I had it, my father had it. I was just curious. You mentioned Parkinson's,
Mhm. What about that?
and well, so you've been able to turn that
Yeah.
around as well, or
Yeah, we've seen
okay.
that. I've got video footage online on my YouTube
Wow.
channel. You can see before and after with more than one person.
Uh-huh.
So yes, and so again, every case is different.
Oh yeah.
Meaning,
Oh yeah.
there's different.
Everybody's different.
It's like if we're rowing
Literally.
a rowboat and there's water coming in. We can either take a Dixie cup and try to empty the water, or find besides that, but find where the holes are. That's letting the water in the
Yeah.
boat. And
Yeah.
so one rowboat might only have one hole, but another rowboat might have 21 holes.
Yeah.
21 holes, you patch up one, you're not going to stop from sinking.
Right.
One hole, one rowboat, you patch up one, that's it. You're safe. So
Yeah.
there are many for Parkinson's. Now, let me just say this in all fairness with what's going on in the world with that terrible condition. I take that very close to me, that condition, because my grandmother's second husband, my mother's father, my grandfather on that side of my family, he died when I was 11. He had a stroke and he couldn't talk. He couldn't move his arm or leg anymore. And soon after that stroke, he passed, unfortunately. A great man, but she lived on. She met another man who she had, like, it was like this high school romance, and they fell in love, and it was great. And he treated her wonderful. I know him for 15 years until when he passed. He passed when I was 30. And he, around when I was 27 or 28, he was diagnosed with Parkinson's. And in 2 to 3 years, it was over. He emaciated.
Wow.
He couldn't feed himself. He couldn't walk. He couldn't wipe himself. He couldn't dress himself. He couldn't do anything. He couldn't even talk anymore. Couldn't even move his body anymore. And that was with great medical care, as they called it, and with the top doctors and great hospitals and great everything. And it didn't work. I didn't know what to do at that time, but what they offered him didn't work. The trusted way of treating did not work. And when we look at other people who are famous right now, I won't mention names. I don't want to have any problem online for saying, but maybe I will. Michael J. Fox is not doing well.
Yes. Right.
And he's got all the money behind him. Not he personally, but there's all these research foundations running and, and collecting money and all these studies done. It's not getting him anywhere good. It's unfortunate. I think he's great. And he was one of my childhood heroes. I mean, Back to the Future, and he was in Family Ties, and I loved his characters. And it's so terrible. It's so unfortunate. I wish I had the chance to do something with him. I think I could. I just don't know how to get to him to be able to do something.
Yeah, the connections.
But with that said, I mean, it's like all that medical intervention, and where's it going? Muhammad Ali passed, and so on. It's terrible. So when I saw my grandmother's second husband pass with the Parkinson's so fast, I realized there's something missing from their side of it too, right? Their side being the conventional medical side. With all the imaging studies, with all the drugs that are available, while they can reduce some of the stress in some people's lives, it's not really getting rid of the cause. What have I found with people causing Parkinson's? I find mercury toxicity in the brain, arsenic in the brain, different toxins like chlorine and fluoride and aluminum, different heavy metals get into the brain and take away brain function. Viruses that people have picked up over time, it could be influenza virus literally, or there could be that got in the brain and changed the brain function. When I took neurochemistry, I'll mention a couple of other points in a minute, but when I took neurochemistry, it was a neurochemistry, neuroimmunology program all wrapped up in one. The immunologist pointed out that there were infections and chemicals that made the disease occur in the brain and the body. Parasites could be in the joints, making the rheumatoid arthritis happen. Mercury from a tooth could be in the thyroid, making a Hashimoto's thyroid disease occur. There could be mold in the lungs, making asthma occur in the patient. So there is proof of the causes of the disease. The neurochemistry part of the program, they taught us, and we had to memorize and draw out maps of the brain and know here's where serotonin is made, here's where the serotonin goes through these different channels to affect these different parts of the brain. Like a quarterback throwing a football, the wide receiver has to catch it to run to the end zone. Well, the serotonin had to be made and then thrown like a quarterback throwing it to another part of the brain to catch it, to make the brain happy or to make the brain clear and function. The same for dopamine. Same for dopamine. So one of the doctors in the very last part of the program, he said, don't try to just supplement. Don't try to be the vitamin replacement for the MD and give somebody like a serotonin supplement that's supposed to, take the place of a serotonin medication. They're fine in their medication. What if you screw up? Don't hurt the person. But don't try to just replace it. You want to be able to, what if you could find what you learned in immunology? What if there's something causing the reduction of the production of dopamine?
Go back
what
down
if there's
the
go down the rabbit hole, so to speak, and find those things. So when I followed that line of reasoning, and I started to put two and two together with the work that I'm doing now. So what could happen is, let's say, what if a person goes to a dentist? I'm not blaming a dentist. I say this message all the time in any discussion I have. What if they were injected in the mouth with a numbing chemical? They had a root canal procedure done. And at the same time, they had a cavity filled, two different teeth. One was a root canal, one was a cavity filling. They had to numb the whole upper jaw to do this procedure. 3, 4, 5 hours later, when the procedures are done, the numbing chemical wears off and the person can feel their mouth again. What would happen or I should say, 3, 4, 5 hours later, when the numbing chemical wore off and the person can feel their mouth, they can talk again, everything is fine, they can swallow, they can spit normal, everything is fine. Where did the numbing chemical go? Did it just disappear? Or did it migrate through the bloodstream and the nervous system to a part of the brain? What if that numbing chemical went to a part of the brain that makes dopamine and it stays in the part of the brain that makes dopamine? What's going to happen to the center that makes dopamine? Is it going to work normal or decrease dopamine production?
Oh, it's going to decrease, of course.
Decrease it,
it's going to get numb.
It's going to get numb, and it stays that way. It's like putting a tattoo ink in somebody's skin. It doesn't leave. It might fade a little bit over the years, but the ink is still there 20, 30, 50, 60 years later. The numbing chemical gets deposited into a tissue in the brain where dopamine is made. What's going to happen to the ability to make dopamine? It's going to decrease. Even if the person is doing great detox strategies over whatever period of time, they're in a sauna, they do lymph drainage, they do an enema, they do castor oil packs, they take liver detox, or whatever formulas they find in Whole Foods or somewhere else. What would happen? Maybe the body's able to pull a little bit of that numbing agent out of that part of the brain where the dopamine is made, but it can't get it all. Just like some of the tattoo ink disappears and it fades, but it's not gone. So, but they can take tattoo ink out of the skin with a certain laser procedure. You need the right treatment to do the right thing. So I find that anesthesia chemicals like dental and surgical anesthetics are in the brain. I find that a virus that somebody got 20 years ago is in the brain, interfering with, even if dopamine is made at normal levels, but it's not being received. Because if that wide receiver running to get the football, his hands or her hands are tied behind their back, they can't catch the ball. What would happen if there's a virus in the part of the brain that's supposed to catch the dopamine and make the dopamine help that part of the brain run? If you got a virus, they're blocking it, or a mold infection, they're blocking it, or mercury, and they're blocking it. There was a study that was done because of an accident that happened in Japan. This is called Minamata disease. Minamata, Japan. It's coined, I shouldn't say coined, the disease is named after this fisherman village. Men and women living in this area that was right on the water. They fished a lot for their food. There were cats on the island as well, or cats on this part of Japan, Minamata, as well. And all these people, and there's video footage of this, of these people in Minamata, Japan, they started developing seizure-like malfunctions that would not stop, and Parkinson's-like symptoms that would not stop, shaking, eyes rolling back, and just balance problems. And they found when they studied these people that it was coming from the food, the fish. What was in the fish? Mercury. Where did the mercury come from? They had a fertilizer production plant that was right on the other side of the water. Where the byproduct of the fertilizer production was mercury. This company was dumping mercury in the water. The fish absorbed the mercury in the water. The people ate the fish. They got mercury poisoning. It screwed up the brain. They know that it was Minamata, what they call Minamata disease, was caused by mercury poisoning in the brain. How do they know? Because they took the cats on that area that didn't have the symptoms. They gave them the same fish that had the mercury in it, that they measured the mercury in the fish. The cats developed the same seizure-like and Parkinson's type of symptoms. They know it was mercury poisoning to the brain that did it. So, so the point is, there's lots of studies out there that prove what can cause a disease, and that my job is to keep
Yeah.
researching and finding what those causes are and provide safe and highly effective, precise quantum energized formulas that people take at home to remove these different disease causing infections and chemicals from the brain, from the thyroid, from the lymph, from the skin, from wherever the disease is happening. And so that we can settle down the stress in the body to help the body rid the symptom and help them restore their health as rapidly as possible.
Yeah.
That's it.
Yeah. No, that makes a lot of sense. That makes a lot of sense. And it probably also, especially with the Parkinson's, explains a lot about the explosion of Parkinson's that kind of happened.
Parkinson's is big, but cancer is big.
Oh yeah.
Autoimmune diabetes is big, and rheumatoid arthritis and thyroid disease and brain fog and I mean, there's so many different ailments that people are suffering from.
Oh,
it's all over.
Yeah.
And you're right, Parkinson's exploded, but so many other things have too.
Oh no, absolutely. Absolutely. Yeah. No, I was just thinking, my father's generation, which, well, he was born in 1908. So, and he grew up in Pennsylvania, where they had a lot
we think of toxins in the air. It's not like the best cleanest air. But what else gets into the water that people are drinking, and that water carries a chemical that goes into the brain.
That's right.
It's devastating. And humans, I think that sometimes humans are like the human's worst enemies. It's terrible.
Most of the time, actually, I think.
Yeah. Why do humans want to hurt other people? I just don't understand it. I don't understand, but that's another discussion. So yeah, you're right.
That's probably true. Yeah. So interesting. Wow. Okay. Well, I guess we need to wrap up. Such a fascinating discussion. God, we could talk, at least I could listen to you talk for hours. Yeah. So let me finish up. Well, first off, I will say that I will put links and things into the show notes. You can send me some, or we'll figure that out. And also let me say that, and I have to say this even though it's not necessarily true, but that neither of us are doctors, and this is not to be seen as medical advice.
Well, I'm a doctor, but I can give advice, yet they've got to be under my care if they're going to follow a plan of action.
Yeah. I agree. I understand. But and so I will say goodbye, and I will see everybody else next week.